So, well, today we have James. He's a returning patient. This is not like the second time here. This is your
Third time.
third time here at Dream Body Clinic. And well, today we are doing different treatments. Have the IV treatment. We have 100 million. We did the prostate treatment, 50 million. We did like the hair treatment, 30 million, and we did the intrathecal, like
Intrathecal.
so. How do you feel after the last treatment? How was the treatment after treatment?
So the last time we did slightly different treatments. We did the P therapy, or what's it called?
The P shot.
The P shots. And then the time before I did the prostate shot the time before. So with the P shot, it was different than the prostate shot. This prostate shot made it so that I went from going P 5 times a night to not at all. And then over the past 18 months since I got it, now I'm back up to going P maybe 1 time a night, sometimes 2, but not 5. And my prostate shrank almost a third. So it's about a third, and the walls got firmer, so it feels just better. And it doesn't push on my bladder as much because it's not bulging as much.
Exactly. So we were watching like the prostate ultrasound yesterday, the recent, and we compare with the last one from 2024. And well, we have the difference from 66 was the last time.
Yeah, 60, 61,
61, 62, and then the recent one is 44.
44,
right?
Yeah.
So yeah, and well, with the IV, how do you feel like?
So that's 66 cc's of prostate down to 44 cc's of prostate.
So yeah, we have the pictures from that. And well, like today we are doing like another prostate treatment because we want to shrink a little bit more the prostate and well to improve and reduce like the symptoms, right?
And it also helps with other things.
Yeah, well, we want to have another benefits from that treatment, right?
Exactly.
Yeah, and right now, like, how do you feel? Like what?
At this very moment in time. So when they did the intrathecal, which is into the spinal fluid, that was the most uncomfortable by far, because the pressure of fluid going into your spine when it's not completely numb is pretty intense and awkward, and it kind of radiates pain a little bit around, but not too bad. And you just really have to relax into that one because it's awkward and it's violating.
Yeah, of course. Like it's different sensation, and well, I think it's always like a little bit more difficult when it's your first time getting that.
Right. And now about 45 minutes later, the pain that was happening from all the nerves being touched is now going away. So it's probably only 10% of what it felt like then.
That's good. And well, I think in general, this treatment is to help to keep everything working good. It's for prevention, and you don't have now like any real or big problem in your brain. It's just to keep your brain sharp.
Yeah, so for this intrathecal treatment for me, I had chemo 10 years ago, and it was because I did a double dose of chemo because I'm a big person and it was far along and the tumors were very large. They did a double dose, which hurts your lungs and it hurts your brain. And so I had something called chemo brain, which in the case that it gets as bad as it got is permanent to some level, maybe like 30% memory loss.
Yeah.
And so my hope is that the chemo brain from doing the intrathecal will go away, and the brain cloud that I generally have where I just can't memorize things or think, I'm hoping that's going to help that, so that I'll be able to, do my work and think better and remember stuff, right? Like names and dates. Yeah. But we also did the hair, right?
Oh yeah, the hair treatment, like
Yeah, and the blood.
yeah, the hair treatment. What do you say? Like, what do you want or what do you expect about the hair treatment?
So in addition to some receding hairline that I've been getting, I have a bunch of friends who are balding and I want them to get it. So I wanted to show them. So I have a little area here that it should help. And if it helps, then I'll show them. I'll say, hey, look, it worked for me. But also I have something called seborrhea. Oh yeah, so I also have seborrhea that kind of comes in around here and it gets flare-ups and it turns red and scaly.
Yeah.
And lots of snow crawls all over my black shirts and stuff. So I'm hoping that it helps that too.
Yeah, this treatment can help because remember, we inject the stem cells, combine it with the PRP in different spots in your scalp. Like the intention is like we inject the liquid spreads on the inside, and we can help to treat like a big area, like bigger area. So the intention of doing the injection in that way is to improve the quality in all the tissues around the needle injection. So yeah, and well, we are doing like the IV treatment also. So what do you?
So I've had 3 surgeries on my left leg and I've got a lot of numbness in my foot. So we're hoping it just helps some of the nerves regrow because there was a lot of things cut. And the other things we want to fix with that is because of the double dose of chemo that I went through, we know that there's been some kidney damage and things like that where they actually saw and looked and I've got not nodules or polyps, what are they called, nodules all over my kidney. They said I had so many that some are just too many to count. And well, of course they get rid of my tumors. All of that made all of these pockets of pus and nodules appear all over my kidney. So I have kidney damage. So I'm hoping to help that too with this treatment here.
Yeah. Yeah, and well, the good news about this is like your kidney function is working good. It is still not affected
Right.
very bad, so that's good. So the best way to know if that treatment is your cholesterol was really good. Like the last time was 250.
Yeah, 250, and now it's down to 170, and then the bad cholesterol is down from 170 to 120.
Yeah, it's working really good.
Yeah.
Yeah, the glucose number it's really good. Like the last time was closer to the highest limit, and this time was really good.
Yeah, so this time my blood sugar is perfect, so I'm not pre-diabetic, and then I'm also, what else? What other numbers?
So we did the red cells, white cells, like your kidney function, your liver function. It's really good. We test your PSA. Your PSA, it's amazing, less than 1.0.
Yeah, very low. So very low PSA, and of course I had a big prostate before, so yeah.
Yeah, like in general, I think everything looks fine. We have different markers better than the last time. So hopefully, like this time, we can have more improvements there.
And then and I gained weight. So typically your cholesterol should go up if you gain weight, but I lost cholesterol and gained weight. So gained muscle.
So that's really good. I think it's always the best option to get more benefit from this is like complementing like the stem cell treatment with diet, exercise, like like your lifestyle. It's really important to get more benefit. Sometimes we say like, oh, I did the treatment, I don't need to do more, but it's always better to complement with a good lifestyle.
And I worked out a lot. Like I was exercising a lot, but then I got too much muscle, so
Yeah, you're a big guy, so you need to.
I like not too big. Yeah, we don't want to be giant. Then you don't live as long.
Yeah, you need to take care of it.